2 national standards organizations were tasked with developing new standards to improve long-term care in Canada and ensure that the tragedy of the pandemic in care homes never happens again.
If these standards were in place before, I believe we would not be leading the world in having the worst performance in long-term care. I think, frankly, we would have been one of the best.
In the first few months of the pandemic, more than 80% of Canada's known COVID-19 deaths happened in long-term care homes. That's the highest such rating among OECD nations. In some provinces, the Army had to be called in to help. As of July of last year, more than 17,000 residents of long-term care homes died from COVID. Today's new standards are voluntary, but advocates want Ottawa to legislate the standards to make them mandatory for provinces.
If there's any resistance from the premiers across the country on any of these standards or any kind of federal interference into this file, I think they're significantly misreading the will of the people that they represent.
The Liberals promised a Safe Long-Term Care Act in the last election, but work on it is in the very preliminary stages. Still, the Minister for Seniors argues even voluntary standards are an important milestone.
These standards will make a difference, and it's a step in the right direction in making sure we improve the lives of Canadians and seniors from across Canada.
The standards cover everything from better infection prevention and control, flexible visitor policies, emergency plans for catastrophic events, and how to mitigate for staffing shortages, to preventing falls, flexible meal schedules, and limiting the use of restraints and antipsychotic medications, as well as how to design new homes and renovate existing ones. The federal government committed $3 billion to help the provinces implement the standards, but experts say it will take much more than that. And even beyond new funding, it will take renewed political will to actually enforce the standards and ensure consequences if they're not met. Karina Roman, CBC News, Ottawa.
Federal Health Minister Jean-Yves Duclos spoke about the proposals. He was asked if long-term care standards will play into negotiations with the provinces on healthcare funding.
This is good news because it's going to help patients and workers live and work in a safer place. And we know that comes with better work conditions for long-term care workers, better physical infrastructure, and better standards to which we can work with, in part, as Minister Kara said, the $3 billion investment that we've announced in 2021. Now we are looking forward to sign agreements with provinces and territories to see how they can use those dollars to further meet these new standards.
Duclos says the standards will, quote, raise the bar for safe and respectable care in long-term homes. Well, Ontario's long-term care minister reacted to the release of these national standards today. When asked if the province will implement the new guidelines, he said Ontario already has high standards, but will look at the federal guidance. The CBC's Megan Fitzpatrick is at Ontario Legislature with more.
Long-term care minister Paul Calandra did not commit to implementing these new federal guidelines, which are suggestions, recommendations. They are not going to be mandatory. It would be voluntary for the provinces and territories to implement them. He said he'll take a look at them, but that he thinks Ontario already has very high standards on its own. So he said he's not interested in watering down Ontario standards. So unless the federal government standards basically meet or exceed Ontario's standards, he's not really interested, but again, he said he would take a look at them. He went on to defend how Premier Doug Ford's government is handling long-term care in Ontario, saying they started making positive changes back in 2018 when they took over government here in the province. He talked about, for example, how they're working towards implementing a goal of providing 4 hours of direct care to all long-term care residents by 2025, how they're funding the construction of new homes, how they're phasing out rooms with 3 to 4 beds. He was asked what he thinks about the idea of accreditation for long-term care homes in Ontario and making it mandatory for homes to participate in an accreditation scheme. He said that Ontario already has very high standards for licensing. Here's a bit more of his response.
But I will continue to ensure that we have the highest standards when it comes to licensing in the province of Ontario. I'm very proud of Ontario's regime for licensing, but as I said, we'll take a look at what the federal guidelines or suggestions will be. My understanding at this point is they're not mandatory, But as I said, I'm uninterested in any guideline that would water down the very high standards that Ontario's put in place with the Fixing Long-Term Care Act.
So again, he says that high standards for inspections in this province, high standards in general for long-term care. And again, he's not interested in watering down those standards. Now, of course, the Doug Ford government had its share of critics for how it handled long-term care during the pandemic. So it'll be interesting to see if there's any criticism or response to the minister's response to these federal standards that have come out today. Megan Fitzpatrick, CBC News, Toronto.